Back. It's Thursday, which is not quite as great as Tuesday when we have Dr. John in studio, but it means we get a virtual house call from Dr. John.
Dr. John joining us via Skype today. So, Dr. John, a lot of people slipping when they're outside today. Have you seen any weather-related injuries?
You know, the main thing we see are exactly that, injuries, and it's usually injuries to the person's wrist because they fall. And what I tell people all the time is think about penguins. Walk like a penguin, feet apart, arms out. Definitely keep your arms out of your hands out of your pockets, because if you fall, you need to catch yourself and just be very careful, especially because there could be ice underneath that snow. You have to really watch where you're stepping.
Walk like a penguin.
Walk like a penguin.
I like
that should be easy for us.
Well, Dr. John, we were talking about germs a little bit earlier in the show, and the CDC says there's a potentially deadly bacteria that could be lurking in our doctor's office.
And it's not in my doctor's office, but what they're saying is that it possibly could be in some doctor's office. It's called C. difficile, Clostridium difficile. This is one that's been around, typically found in hospitals. But the CDC study says that a substantial number of people actually got the bug who hadn't been to the hospital, but instead they had recently visited their doctor or their dentist. Well, the CDC is so concerned about this right now that they're starting a new study to try and figure out nationally whether people are actually getting this from their doctor's office. It's hoping the study will determine what we call the cause and effect. Which happens first? Is it because it's possible that the patients had C. diff to begin with and then went to the doctor's office to get help, or is it in fact from the doctor's office? Now, the CDC says patients should wash their hands after visiting their doctor's or dentist's office, wash them with soap and water, because alcohol-based gels don't really get rid of it that well.
Interesting.
Well, Dr. John, you know, many people are taking statins for high cholesterol, but the pills could be protecting you from another disease?
Right, and statins have been phenomenal for cholesterol. They've been the one thing that's really dropped cholesterol in a lot of people. Well, researchers found that people who get statins also have a lower risk of getting liver cancer. And this news is especially important for people living with diabetes, obesity, or liver-type diseases, because those are conditions that can contribute to that higher risk of liver cancer. And we're finding out more and more just how good statins are. And again, they're phenomenal for lowering cancer, lowering risk of cardiovascular disease. Now it looks like they can help with liver cancer as well.
Migraines, Dr. John, a big problem for people who have them, obviously, but turns out there's a new way to help with the symptoms.
And, you know, at Premier Urgent Care, we see people with migraines all the time, and you can just really feel for them. I don't suffer from them, but you can tell when they have them, they're really suffering from them. Around 36 million people do get migraines, and unfortunately there's no cure for them, but there are alternatives besides drugs that can help with the headaches in some people. Exercise, specifically cycling, may have some beneficial effects. Number one, it's low impact, and it releases endorphins. Those endorphins can help decrease pain levels. And a Swedish study just found out that a regular indoor cycling program improves migraine symptoms in some people. But as always, consult your own doctor first, since exercise has also been known to trigger migraine headaches. Everyone's completely different when it comes to migraines, so you have to find out what's going to work for you and what's not going to work. Not everything's going to work for one person.
So, Dr. John, if you suffer from migraines, a spinning class may be a good option.
It could be a good option. Like I said, for some people it might unfortunately trigger them. For other people it could help with them. You don't know which category you fall in until you actually try it. And so again, it's like any of the migraine medications, any of the migraine treatments, not everything works for one person. It depends on you, your body, your migraine, and how it affects you.
All right, good information. Thank you so much, Dr.